Can heart palpitations and tachycardia really cause heart failure? Actually, yes, it can. And it can definitely aggravate existing heart failure as well. I'm Jodie Ann Senior, I'm a heart failure specialist, and I just wanted to share with you one of my experiences currently, actually, with one of my patients. So I have an inpatient at the moment, and he was referred to me by another colleague. He'd had problems with a tachycardia. What tachycardia? Actually, it was atrial flutter. There are a number of tachycardias or fast heart rhythms that fall in that category of atrial tachycardias. And what that all means is that the heart beats very quickly. When the heart beats very quickly, it isn't as able to efficiently pump the blood around the body. There's a kind of a forced relationship curve where just increasing the heart rate a bit as you say exercise actually improves your cardiac output. And we know that physiologically, but there's a point beyond which that heart rate becomes ineffective and indeed detrimental. And so if the heart rate is beating at, say, 130, 140, 150 plus beats per minute at rest when you're not doing anything and you don't need it to go that fast, and it persists and persists, then over time that can cause heart failure. So what did we do about that in his situation? One of my colleagues is the electrical side of cardiology. So the electricians will deal with these fast heart rhythms. They might start with medications, and then if that isn't sufficient, then they will look to what we call an ablation. And an ablation is when a cardiologist who's trained in this electricity side of things uses a keyhole approach to get inside the heart with catheters, find or stimulate that area that's going haywire with the electricity and causing the rapid heartbeat, and then actually do what we call an ablation, which if it's a radiofrequency ablation, then they use heat to burn that electrical circuit and prevent it from becoming an ongoing issue. Or they can do something like cryoablation, which would be, as it sounds, it freezes that tissue. And again, it just causes that tissue not to be able to keep conducting that electricity through at a rapid pace. And that, of course, then leads to better control, or hopefully a reset of the heart rhythm back to normal. And in this case, that's what's happened. It's allowed the patient's heart to actually use the pacemaker, which he already had, which was designed to help his heart pump in a regulated way rather than be overrun by this arrhythmia. So that was the first step. He's had that done. He has the pacemaker already. The heart rate's come down. We've also used medication to help that. But now that we've calmed it down, we have to deal with the fact that he now, as a result of that heart failure, has a lot of excess fluid. We've used fluid restriction, daily weighs, and monitored his urine output to assess. And over time, his weight has dropped already about, let's see, he was at 74 to 75 kilograms. He's now down at just at around 68, which suggests he's now lost around about 6 kilograms. That's a rapid weight loss over a period of a few days. That can only represent fluid loss from the body or water weight. And that was actually sitting in his lungs, making him very short of breath. So this has actually enabled him to feel a lot better, breathe a lot better, have better oxygen saturations when we check that on the monitor, allow him to breathe more comfortably, both at rest and with exertion, so walking around, going to the bathroom, that sort of thing, having a little wander down the corridor, and feel more comfortable doing all of those things. so that we can re-stabilize his medications and then let him go home. Before he goes home, I'm going to teach him balance those medications to keep what going out the same as what's coming in terms of what he's drinking versus what he's passing out. That is going to let us know that we keep his water weight stable, because we're going to monitor his weight each morning. And if he stays within 1 kilogram of his discharge weight, so let's call that at 67 to 68 kilograms, then we know he's not accumulating excess water and getting himself into trouble all over again. So it's a simple way to achieve that better balance of fluid, and then monitor it and make sure that he stays on that path so he doesn't bounce back into hospital. Now, could he get further arrhythmia that bounces him back? Yes, that's possible, but hopefully we've reduced that risk significantly, and obviously we'll be watching out for it. But that water weight will give us a clue as to what is going on and if he's becoming unstable. My job will be to help him, teach him how to do this on his own with support from his medical team, which includes me, because he's from the country, so he has to drive a good couple of hours to get to come and see a doctor. So I want to make sure he's well educated, that he can really manage this largely at home, out of hospital, liaise with his GP where necessary, liaise with me where necessary, come in and see me when necessary, but hopefully at a minimum, and keep him out of hospital, keep him well. So I hope that story gives you a little bit of an understanding of what this tachycardia actually does, what it can cause, how we might go about treating it or managing it, and the impact of that. If you do have questions about that, or I didn't explain something well, please let me know so that I can address that for you. But if you don't mind too, if this information that I'm presenting to you is relevant and interesting to you, then please subscribe to the channel so you don't miss any future content. These videos are designed for education purposes. Everybody's situation is individual, and don't forget, you need the guidance of your medical practitioners. Since I'm not your doctor, if you're my patient, then I am your doctor. Use me, help you. But yes, please use this information to inform yourself, to empower yourself, to know what kind of questions to ask, when to go to the doctor, when it might be okay to perhaps wait, when you need to elevate it and go more quickly. Anyway, thank you for giving me your time and attention, and I'll see you on the next one.